talk with you today about our recent publication, Attachment, Parenting, and Obesogenic Behavior, a Dyadic Perspective. I am Angela Lamson, and I'm here with my colleagues, Dr. Katharine Didericksen, Dr. Andy Brimhall, and two colleagues who were not able to join us, Dr. Ashley Mogg-Winter and Dr. Suzanne Lazorick. I'm going to share with you a little bit about some real-world applications from our article. The first is that as researchers, we get excited about learning. I think an important step that we took with this project, and we encourage others to take, is to find or construct, implement, and pilot test your assessments so that you recognize the diversity of the clients or patients that you're serving. As researchers, we need to make sure that our concepts make sense across a variety of social locations and that we are linguistically aware in what we are asking. Also, thinking about the literacy levels and the primary language of the participants that we're engaging with. Secondly, I hope we can work to be more intentional about how to adapt our assessments and research designs to capture the context in which individuals, couples, and families naturally receive care. For example, how might we as marriage and family therapists or medical family therapists enhance the ways that we assess for attachment and or self-regulation of eating, two constructs that are a part of this study with both diverse populations and in contexts such as through healthcare visits or as part of a healthcare team in a school, where these visits are likely to be very brief.
Excellent. I was going to talk about the implications for Mfts. I had a college professor that once talked about the purpose of the task is to strengthen the relationship. And one of the things we found in this study that was kind of reinforced by other literature is that the attachment relationship does influence how children thrive. And so from a biopsychosocial perspective, we know a lot about psychosocial, but this specifically talked about some of the behavioral implications or the biological implications of that attachment relationship and how it influenced the children eating. And so teaching parents the importance of that relationship, I think, is crucial in the work that we do.
We also need to think about future research implications and where research should go in the future. The first of which is to be able to measure these constructs as we have observable data for attachment, as well as then creating and constructing reliable and valid measures for children in middle childhood, as well as Hispanic populations for constructs such as self-regulation, caregiving style, parent modeling, and so forth. We really would like to move the needle in terms of cultural humility in research and make sure that it is applicable and appropriate.